Meanwhile, health authorities reported that more Etihad passengers who have undergone swab testing have been found negative of the deadly virus. The full report from Freddie Abando.
The Department of Health has intensified its contact tracing of 414 passengers on board Etihad Airways Flight 424 that arrived April 15 at the Ninoy Aquino International Airport. They will be subjected for tests to determine if they are positive for the Middle East Respiratory Syndrome coronavirus. MERS is a highly fatal influenza sickness accompanied by fever, coughing, and diarrhea.
We started processing the samples nung Thursday pa. When the samples came here at 2 o'clock from Bicol. So the samples were processed and the results were immediately released. So, but there are only 13 samples then. Now we have more than 13 actually being tested in the laboratories on a daily basis.
So a total of how many?
Total of 198 EDLCs, but these are not all passengers. Some are contacts of passengers. So we've been deluged with other subjects who are not really passengers in the plane, but they include some other contacts. We just focus on the passengers for now because that's the marching order of the president. We have to make sure that all the passengers on that plane have been contacted and have samples submitted for testing.
One of the passengers, a nurse a Filipino nurse who died of the MERS virus, was quarantined with family and tested negative and was sent home. To date, the DOH bared contact details of 373 passengers. 173 of them were contacted with the support of the Philippine National Police.
They're coming from the north to the south. We've seen the data from HEMS last Saturday, coming from Region 1 all the way down to Zamboanga. So, but yes, they're being transported here. We pick them up in the airport if they call us, and we bring them to the laboratory. We need to make sure that these passengers are contacted. They have samples given. They're brought to hospitals for observation. If they refuse, the PNP will help us make sure that they go to hospitals for swabbing also. So we want everybody to submit a sample and to come in for observation.
The contacts of the contacts, you know, these are not our, because in the first place the contacts are negative, so there is really no transmission.
Every case is reported to the National Epidemiology Center. The Research Institute for Tropical Medicine confirms the diagnosis. To date, the institute has conducted tests of 41 passengers, 27 tested negative, 14 are still confined at the institute. Some are under observation at the Vicente Soto Hospital in Cebu City, a few at the Long Center in Quezon City. Samples are secured from each passenger and undergo molecular analyses. Latest update as of 12 noon, 125 tested negative, 54 are under process. In the meantime, the Bureau of Quarantine has intensified its screening of passengers arriving from the Middle East in all of the country's airports. Travelers have been advised to avoid contact with those having flu-like symptoms and observe regular washing of the hands. If they get sick in 14 days, it's advisable to report their case to a hospital.
On them to report to any DOH hospital or to any DOH facility if they present with symptoms within 14 days coming home from the Middle East. That is the only way we can track whether or not they're sick with MERS coronavirus. Otherwise, if they don't report, they get sick, then everybody else gets sick, we will have an outbreak. So really, those coming from Middle East, please report to the DOH or any hospital facility if you're sick within 14 days from arrival.
For the People's Television Network, this is Freddie Abando reporting.